Good afternoon and welcome to the Colorado Fruit and Vegetable Growers Association Lunch and Learn webinar, Worker Health and Hygiene during COVID-19. I'm Adrian Card with Colorado State University Extension and board member of the Colorado Fruit and Vegetable Growers Association. I'll be your host for today's webinar. Today's webinar will focus on helping you learn up-to-date practices for keeping your workforce healthy and safe, as well as resources to use on your farm. CFVGA is the go-to resource for Colorado's fresh fruit and vegetable farmers. We connect Colorado growers with industry, government, academia, and consumers to strengthen and expand Colorado fresh fruit and vegetable production. Learn more at coloradoproduce.org and follow CFVGA on Facebook and Instagram. A little bit of housekeeping before we get started officially. As most webinars, our primary interface is going to be a Q&A box. So you'll notice that you won't be able to use chat during this webinar. So use the Q&A box to type in your questions. And these will be answered during the presentation and after the presentation is appropriate. We'll run today from 12:10 to 1 p.m. And if you need to hop off earlier, know that this is being recorded and will be posted to coloradoproduce.org. You can resize your Zoom window. If you're on one monitor, you can make it exit full screen and drag it so that it's the appropriate viewing size for you. And there'll be two polls at the very end of today's webinar to determine educational outcomes. Look for that window when the polling is launched, select your response. And for those of you viewing this recording, the polling is not visible in the recording. Today, I'm so pleased to have two of my colleagues as presenters in today's webinar, Martha Sullins and Christy Dice from Colorado State University Extension. Martha works as the Front Range Regional Specialist in Food Systems and Business Management, and Christy works as the Extension Regional Specialist in Produce Safety. Both are leaders in the Colorado Produce Safety Collaborative. With that, Martha, I'm going to pass over screen sharing to you.
Great. Thank you, Adrian. And thanks everybody for joining us here today. We're glad to be able to chat with everybody about worker health and hygiene during COVID-19 and how we can limit the spread of this new virus. And just a quick caveat, all of the information we're presenting today is sourced from public health authorities. It's current as of today. As we know, this is a rapidly evolving situation, and so we're trying to stay up to date and bring you the latest information too. Adrian mentioned, I'm Martha Sullins. Christy Dice is my co-presenter. We'd really like to say thank you to Chelsea Didinger, who is in the Department of Food Science and Human Nutrition at CSU. She did a tremendous amount of work on graphics to try to really help us understand the best practices behind glove and mask use, and also to Marissa Bunning, who's a professor in the department, for all of her review and input. They were both invaluable in helping us put both this webinar together as well as what turned out to be a series of webinars. So we're hoping you all will join us next week when we talk about cleaning and sanitizing. We felt like we had three topics that deserved a lot of depth, and we really wanted to share with you as much detail and information and resources. So we divided this into three parts. You get worker health and hygiene today. Next week, cleaning, sanitizing, and then disinfection best practices. And then the last week, we're going to look at some of the logistical and sanitation considerations and best practices, focusing on points of sale, particularly in direct markets. You'll find all of these recordings both on the CFVGA website, and we'll also put them on coloproducesafety.org. So today, focusing in on worker health and hygiene, we're going to cover first what we know about this novel coronavirus. It's really important that we give you some background so that you understand why the health and hygiene practices that are being recommended by CDC and FDA and the WHO, why they're so important. And then with that knowledge, you can really work to develop different risk management practices and understand how you can apply some of these practices on your own farms. And as information evolves, we're also going to be providing you with a lot of resources, so links to signage and training materials in multiple languages, also some templates that you can use on your own farm. And we're hoping that we can shortcut a lot of research that you would otherwise have to do by putting it at your fingertips. So we'll have links in this PowerPoint, which you'll get access to. There are also a lot of links, which we'll show you later, on the website too. So first, for that quick overview, the first thing to highlight is that coronavirus 2019, or COVID-19 as it's called, is a respiratory illness that can spread from person to person, caused by the virus SARS-CoV-2, which stands for Severe Acute Respiratory Syndrome Coronavirus 2. So quite a mouthful, but that's the name of the virus. Again, let's remember it's a respiratory illness. It is not a foodborne illness. So a lot of times we have always talked about food safety and produce safety in the context of foodborne illness. This is entirely different. And that's why we're going to start with worker health and hygiene and talk about this human-to-human transmission and how that occurs. Remembering that, it was the end of December 2019 that we really first started learning about the impact and how this virus behaves. So looking then at the fact that as a respiratory disease, it is coughed out, the virus is coughed out, sneezed out, or comes out through talking, through different size of droplets that can either be directly inhaled by people who are standing nearby. They could land on a surface and someone could touch that surface immediately, transfer it to their nose or mouth. There's never been any evidence that COVID-19 or the SARS-CoV-2 virus, it can be ingested, can travel through the digestive tract and cause someone to be ill. Again, it's not a foodborne illness. All the research points to this. The other thing that's really important to notice is that most of this transmission, although not all, seems to occur within that 6-foot range. So that's kind of that limit that we're going to be looking at for minimum social distancing. And we'll talk about physical or social distancing. And another important consideration is that COVID-19 can also be spread by people who they're not manifesting any symptoms at all. And ranges of the population that are asymptomatic, not showing any symptoms, is 10 to 25%. We've seen research demonstrating as high as 50%. So that really goes back to emphasize the importance of all of these precautionary measures, because someone who's asymptomatic may be pre-onset, or they may be someone who never manifests that disease at all. So we're going to really talk a lot about physical distancing and face coverings as important ways to prevent that person-to-person transmission. Surfaces. So I alluded to this. There was a study that came out in March from the New England Journal of Medicine showing that SARS-CoV-2 can live both in the air and on surfaces. Some of the periods of time that they studied on different surfaces and they found a viable virus, although we don't know if it was at an infectious level, 72 hours on plastics, 48 hours on stainless steel, 24 hours on cardboard, 4 hours on copper, and then that it was detectable aerosolized or in the air for about 3 hours. Well, there's since been a lot of investigation into the research methods. They're laboratory based. So there's just no clinical evidence that out in the environment, COVID-19 can be transmitted via food packaging, any kind of a surface. And we also know that, typical environmental conditions, high heat, changes in pH, and disinfectants can certainly facilitate how quickly that coronavirus dies off. And we'll talk about this in hand washing, but the structure of coronaviruses makes it much easier to break them down and kind of debilitate them using disinfectants, sanitizers. Even cleaning with soap is one mechanism for breaking them down. So one of the things that we put a little public service announcement from Frank Yanis of FDA down here so that you can read the messaging behind the fact that our food supply chain is safe, our produce is safe, and there just has never been any evidence of food or food packaging being associated with the transmission of COVID-19. So our key takeaways and what we're going to keep coming back to today is that we really need to focus on reducing that person-to-person transmission. We want farm employees to be safe. We want customers to be safe. So we really want to look at all these health and hygiene practices, many of which you've been doing for years because you've been practicing good agricultural practices. You've had stringent produce safety protocols in place. So that part isn't going to change. There are just some additional considerations that get layered on top. We emphasize even more the importance of keeping our hands clean, so frequent hand washing, more frequent cleaning of food contact surfaces, and then other surfaces that may not come into direct contact with food, but they're high touch surfaces like steering wheels, doorknobs, touch screens that do need to be cleaned and sanitized much more frequently, because we don't want someone to sneeze or cough or talk on a keyboard and then someone, they transfer it into their eyes or their nose or their mouth. So we're really looking at reducing those mechanisms. And then the last consideration is, again, that social distancing. And so, and complementing that with face coverings when we can't keep that distance of at least 6 feet. So those are going to be our key takeaways that we're going to talk about throughout production as we discuss worker health and hygiene today. So Christy.
Thank you, Martha. And just another thank you to all of you who are joining us today. We really appreciate your time. So one of the best things you can do to be prepared to deal with this novel coronavirus is educating yourself. And so we're going to spend some time talking about the symptoms of COVID-19, and then we'll get into more areas where you can educate yourself and your employees. CDC says that fever, cough, and shortness of breath are the main symptoms that indicate you might have COVID-19, and these symptoms can appear from 2 to 14 days after exposure. Fact sheets and videos are available on CDC's website. You can see there on the left side of your screen that there's some examples, and then there's a website that's listed there as well where you can get those examples and additional examples. So these can be really important tools that you can use to train your employees and review those symptoms with your employees. I know many of us probably feel like everybody already knows what the symptoms are because they've heard it, but we still keep hearing indication that people still are not quite sure of what the symptoms are. So it can just be really good for you just to ensure that your employees understand what the symptoms are and what you should be looking for. And then some other things to consider are that recognizing that not all COVID-19 carriers are showing symptoms. And so, that can be really important because for that social distancing and physical distancing that Martha talked about a minute ago, and that we'll spend more time talking about in the next several slides. And then the other thing to think about is having someone trained to look for signs of illness in your employees. It can be hard for people to admit sometimes when they're not feeling well. As farmers typically want to just tough it out, but that's not a good option here. It's best just to try to take the time off and get well. And so having somebody that can recognize when employees aren't feeling well is going to be a really good thing as well, just to keep you and your workforce safe. And these two documents that are pictured on the screen, like I said, there's a lot more, but the two that are on here, the symptoms of coronavirus, that one's available in many languages, including English, Spanish, Chinese, Korean, Vietnamese. And then the feeling sick one on the other side with the big stop sign on it, that one is available in English and Spanish, and you can also get that in larger sizes. So you can download those off of the website that's provided there, and you can print those for your use. And I don't think we mentioned in the beginning, but this presentation will be provided to all of the attendees.
Christy, I think we lost you.
Are you there?
Christy, I can hear you fine. Keep going.
Good.
Okay. I'm not sure if it was mentioned in the beginning, but this presentation will be provided for all of our attendees afterwards. So you'll have access to these with the links on them. Next slide, please. So here's some more examples of information available. So there's a fact sheet about COVID-19. So it gives you some more facts, and then also just a good document that talks about stopping the spread of germs. And so the shared facts about COVID-19, that one's available in English, Spanish, and simplified Chinese, and stop the spread of germs is available in many languages, including Ukrainian, Vietnamese, Haitian Creole. I mean, there's a lot of different options there. So again, just go to that CDC website for these fact sheets in multiple languages to help communicate your the information to whoever may be in your workforce. Next slide, please. So the next thing we're going to talk about is really thinking about hygiene practices for yourself and your employees. And so making sure that everybody understands what good hygiene means. We talk about this a lot with foodborne illness, but it's especially important with COVID-19 as well. The structure of coronaviruses make them particularly susceptible to soaps and hand sanitizers, and so that graphic that we've provided there is a really good example of this. It discusses, that the structure of this virus allows that the soaps to dismantle the virus basically and inactivate it, and so this really makes it important for us to think about increasing our frequency of hand washing and really focusing on hand washing. So this is a good time for you to think about, what your hand washing policies are, retraining your employees, reinforcing those practices, and then also increasing the number of hand washing stations available for your employees to use. It's not recommended to use hand sanitizer in place of soap and water. I think we've all heard that a million times, but thinking about increasing the frequency of getting those germs off of your hands, it is definitely an option in when we think about our hand hygiene in relation to COVID-19. And so if your hands are not visibly dirty, then you can use the hand sanitizer, it'll be effective. But if they do have visible dirt on them, then that hand sanitizer isn't going to be effective. And so I think about like hand harvesting practices. So if you're doing hand harvesting and you've gotten a bunch of organic matter on your hands, the hand sanitizer won't be effective against anything that's on your hands. But if you think about if you're taking money, like in a retail setting, generally money isn't visibly dirty. It definitely is dirty, but it's not visibly dirty. And so in that situation, hand sanitizer can be effective because you don't have that dirt as a barrier on your hands to making it effective. But if you're going to use hand sanitizer in addition to your hand washing or in place of some hand washing when your hands aren't visibly dirty, then you want to make sure you do wash your hands as soon as possible and as frequently as possible throughout that use of hand sanitizer. So again, just making sure that you're taking the time to scrub your hands and get those germs off with soap and water. And then the other thing to remember is that if you're going to use hand sanitizer, make sure it contains at least 60% alcohol. Apply it to your hands and then rub them until they feel dry. We did get a question in the Q&A that asked about, if gel or liquid is better, and there hasn't been anything to support that either one of those products is better. Just that important thing is that it contains that 60% alcohol, and that you rub it on your hands and then you keep rubbing them until they feel dry. Next slide, please. So again, hand washing is very important. It's really important that you review hand washing techniques with your employees. Many of you have probably seen this graphic that's on the left. We have that posted on our website. It's available in English and Spanish. It can be a good tool that you can use to train with, or you can post that around your facility just to keep that front and foremost in everybody's minds about hand washing. And so in addition to the correct ways to wash your hands, you also want to teach your employees, again, when to wash hands. So always after the restroom, anytime they leave their workstation, so if they take a break or if they go to eat, always want to make sure that they're washing their hands before and after that activity. Anytime they blow their nose, touch their face, cough, or sneeze, again, just want to make sure that they'll get a good hand washing in after those things occur. Anytime animals are touched, animal feed or animal waste, again, um, these are definitely potential ways that normal foodborne illness can be transmitted. And so again, just thinking about good hygiene practices and making sure that we're thinking about any time our hands have become contaminated, not just with COVID-19. Anytime before putting on gloves, you always want to make sure you have a hand washing step. And then the new one, which we're incorporating into this now, is also after contacting those high touch surfaces or any shared equipment. So as Martha mentioned, there's a lot of high touch surfaces that we have around the farm. And so just thinking about making sure that we're doing some hand washing after those activities occur. And any shared equipment. So if there's, if you guys are out doing some weeding, or you're using hose or shovels or something, just thinking about and sharing that equipment amongst each other, just thinking about doing a hand washing step after those activities as well. We also have, in addition to this graphic that's provided, we have some videos on our website that also teach about hand washing. So you can use those to train your employees as well. Next slide, please. So to help you increase the number of hand washing stations, we put together a list of some options that you can do yourself or purchase that are maybe outside of renting those traditional hand washing units that we typically see on farms that come along with your restroom facilities. And so the first option there, that complete sink for purchase. So I actually bought one of those and I put it together, and it works really well, honestly. It's not huge. It doesn't have a large reservoir of water, but it can get the job done for maybe when you guys are out in the field and you're trying to increase the frequency of the hand washing, and just having that available. The one in the middle, build your own sink. So that first bullet there, the one that I have labeled as ideal. So that one, it's ideal because it's hands-free. So it's kind of hard to see in the picture, but on the ground, there's a blue foot pump there. And so the idea is that you push the pump and the water comes out the top. And so that one's ideal in the sense that you don't have to use your hands to turn, the faucet on and off. And so that's a good option as well. And that if you go to that Instructables website, you have to create an account, and it's free, but you can download those instructions then. And then the second option under that is the University of Minnesota put together a document that describes building a hand washing station. And so you can buy all the parts for that for about $20. They say, when I bought them at Walmart, it was about $30, but you can buy them for about $20 and build your own hand washing station. So it gives you instructions on how to build that wooden support system that goes along with that. So that one's a little less ideal because, again, you have that blue carboy that you have to turn on and off with your hand. It has a nozzle to get the water to come out. And so that's less ideal, but again, if that's all you have and you're looking to increase your hand washing, that's really important. And then the last box on the side there, the sink parts for purchase. So on Amazon, they have this set up where you can use that foot pump and incorporate it into some other version of a hand washing station. But I liked that because it had all the parts again together and available. You just need to add a few extra things like a bucket to draw the water out of, or some vessel to draw the water out of, and maybe a cover over the foot pump just to make it a little more usable. But the things to remember when you're building a hand washing station is that you have to provide water that contains no generic E. coli. You need to provide soap. You need a container to catch water. You need paper towels to dry your hands on, and then you need a trash can. And again, the ideal setup is one that does not require you to use your hands to turn on. So then, on all those pictures I just showed you, there wasn't any trash cans. So I wanted to say, don't forget the trash can. This is something that we saw farmers needed repeatedly when we did our farm visits last summer. And so keep in mind that it should have a lid or it's somehow enclosed. It needs to have a liner so you can get the trash out of it without contaminating things around you. Some of the complaints we heard from farmers is that they blow away. So think about putting rocks or sandbags in the bottom of them for weight. And then again, maybe you can find an option that's hands-free, open or closed, just to try and limit the potential for cross-contamination. There's a lot of options available for trash cans. Next slide. So now we're going to switch gears and talk a little bit about gloves. This is a huge question we get from farmers right now. And so we put together maybe some best practices on how to use gloves and when to use gloves. So because we've heard that gloves can be difficult to find right now, it could be helpful to prioritize when you're going to use them. So if you have access to adequate hand washing stations and you know your employees are being diligent about washing their hands frequently, maybe your use of gloves can be reduced. You could just use them for activities where they're handling the produce or when they're in a retail setting or taking payment from customers. So maybe think about those areas where it's a little more necessary for you to wear gloves as opposed to just saying you're going to wear them all the time. So some other things to keep in mind is, remembering that you might need multiple sizes to accommodate any employees. Not having the right size of gloves can make them either tear easily or they can fall off or they're just not comfortable. So thinking about that, and then providing training for your employees on how to use the gloves. And the training really should include, again, washing your hands before putting on gloves, and then also when you want them to change them. So then another thing to remember that we see a lot, or I've experienced a lot myself, is not blowing into the gloves or rolling them to make them easier to put on, especially now with COVID-19. We don't want to contaminate those gloves before we even put them on. Next slide, please. So there's a couple of different types of gloves. There's those disposable gloves that we're all familiar with, and then there's reusable gloves as well. So the disposable gloves, they're either latex or nitrile or some kind of blend of a rubberized substance. And so again, you really want to make sure you're training your employees how to put them on and remove them properly. And then thinking about when they should dispose of those gloves. So when they become torn or they become contaminated. So if your employees touch their face, or if they touch something else that might contaminate them, that would be the time when they would want to make sure that they change them. And if you are lucky enough to make it through a task for 4 hours without ripping or tearing those gloves or contaminating them, then you should definitely change those disposable gloves after 4 hours. I'm not sure how feasible that is, but that's the recommendation. And then if you think about reusable gloves, so those come in a variety of materials. They could be fabric or leather or neoprene, and each of those has their own advantages and disadvantages, and farmers use, the ones that work for them. But one common theme to think about with all those materials is keeping them clean by frequently washing and drying those gloves. And then again, you need to train employees on being able to recognize when those gloves should be disposed of. So when they're worn and have potential cracks in the material, or if they tear, or if they're just so dirty they can't be cleaned, those are times to make sure that they get disposed of. Next slide, please. So to help you remember all this information about glove use, we've created a fact sheet for you all. You can use this to train your employees, and you can also print this and post it in areas where employees will be accessing the gloves as a frequent reminder of the importance of using those gloves correctly. And again, even though it may seem obvious that employees would just know when and how to use gloves, we've seen it on a lot of farms that when people use gloves, it makes them feel like they're invincible and they can do anything when they have gloves on. And so it's just really important to reinforce those best practices around using gloves.
Christy, question on really the when and why to wear gloves. I think Martha may have just answered that. If it doesn't transmit foodborne illness, then is it really important to wear gloves? And it looks like on this slide, bottom left, maybe you've answered some of that.
Yeah. So so just thinking about we're talking a lot about cross-contamination here, and so just an added step of preventing that cross-contamination is why some people have decided they want to use gloves. They feel like it provides that extra layer of protection for their employees and for themselves, and so that would be my recommendation for using gloves.
Great.
Again, they carry their own risks when you use them.
Sure, it still have to be cleaned. Is this poster for the gloves posted online somewhere?
Yes, it is on our website, and we will go over that at the end where people can find all of our resources we're presenting today.
Great. Could I back you up a couple of slides? Somebody asked related to the hand washing stations, how to keep the station clean and where the station should be situated in the sun, in the shade, how often to change the water.
So as far as, okay, so the first part of that is where to locate them. So located in a central place to your wherever your employees are at. So if they're out in your fields, have it in a central location that's outside of the growing area, outside of your field, in a field road, somewhere where, you know, it's not going to contaminate produce while they're washing their hands. The sun or the shade, that's totally up to you. I think, you know, whatever the comfort of your employees in wherever that would be a good choice. But also just, again, thinking about keeping it outside of those growing areas so you're not contaminating the produce with any potential splashing or spilling from washing your hands. And then was there a third part, Adrian?
How frequently to change the water, how to keep the station clean.
So as far as changing the water, the stations that I showed have reservoirs. So they have a bucket that holds clean water. And so when that gets empty, it will need to be refilled. And then they also have buckets that catch the dirty water. So just making sure that you're emptying that bucket so it doesn't overflow or it's not splashing outside of the bucket. And I think most of the other hand washing stations we've seen have some sort of catch basin that you would just need to monitor and make sure when it got full that you would empty. And then you would take that water to someplace outside of your growing areas, away from traffic, where people wouldn't be walking through it or vehicles wouldn't be driving through it to dispose of that dirty hand washing water. Just think about it, you know, you're washing all of that bacteria off of your hands into a bucket. You certainly don't want to put that in a place where people are going to come into contact with that. So keep that in mind as you're disposing of that water as well.
And cleaning any of the surfaces a person would touch as you would any other surface with cleaner and sanitizer.
Yep, definitely. Yep.
Is this going to be, I think Martha grabbed it, is it going to be in Spanish too?
Yes, eventually.
Okay,
we will work on
great.
getting that done through CSU. We have some resources to get some of this stuff translated.
Perfect, thank you.
And back to you, Martha.
Great. All right, so we talked about gloves. Now we want to talk about masks or face coverings. And so earlier this month, the Centers for Disease Control recommended that people wear cloth face coverings in public settings where other social distancing measures, so we talked about that 6-foot separation, would be difficult to maintain. And the food and ag industries have really come along behind this as a way to limit that viral transmission. As we know, just like gloves, there are pluses and minuses to using face coverings. You know, we know they're going to be hot. They can get contaminated. And so on the next slide, we'll show you some information that we have about keeping those face coverings in a safe and sanitary measure. But one of the key things is making sure that you put that mask on properly. So there's some instructions on this slide about fitting the mask, whether it's a cloth mask or a disposable mask, to your face, making sure it's secured, that you can actually breathe and go about your work without interference, and that it covers both your nose and your mouth, because you know you can respire droplets both through your nose and your mouth. The one thing, of course, that we've all heard about is it's preferable to use these cloth face coverings and not surgical masks or N95 masks, because those are really needed by our healthcare workers. And there's definitely been some debate in the research community about the effectiveness of masks. But again, because the Centers for Disease Control is advising their use, this is, again, what the food and ag industries are advocating. So here is a similar best practices sheet that we will need to get translated into Spanish. We only have it available in English right now, but really shows you how to correctly put on a face covering and then considerations about taking it off. A key thing is, well, two key things are making sure that you wear a face covering at those times when it's really hard to keep a social distance of about 6 feet. So meetings with employees, coworkers, maybe at a farm stand or farmer's market situation, inside of a packing house, or maybe in a field situation where you just have to be in closer contact. Important to remember that those face coverings need to be kept clean. And so if they're cloth, they can be washed and dried and then reused. They should be washed and dried, every day, at least, unless something happens and they get soiled. But just being vigilant of the fact that as you put it on and take it off, you need to put it on with clean hands. And when you take it off, you don't want to put it back on again if you've put it down in something soiled or you've touched it with your hands. So here are some best practices for you on this sheet. You can access the link on our website. And so then kind of diving more into physical distancing. So we really want to focus on this to reduce that person-to-person transmission. And I know this is a really tough area because there's so many operations and areas where you just need to have people being closer together. But one important thing is just that, raising awareness of what 6 feet is. So there's a graphic on your right that kind of gives people, maybe it's a sorting bin, or maybe you put tape on the floor of your office, kind of directing people where they go in the break area, what about 6 feet looks like for them, because everybody can view that quite differently, but just those visual reminders of about where they should be positioned when that's possible. And then, of course, break areas are, we thought we'd talk about that first, just because that's an area where you would think, everybody's just going to relax, but it's really a time when there can be a lot of congregating. And so maybe staggering breaks, creating additional areas where employees can be more distant, emphasizing the fact that, you don't want to use physical greetings, but just like smiling, waving hello is a good enough greeting. And then, making sure that those break areas are cleaned and sanitized on a regular basis. Restrooms too, on a daily basis is going to be really important, because they're, some of those high touch areas. Some other areas to think about staggering employee contact is coming to work, leaving work, maybe, staggering shifts a little bit, just so that you don't have as many people coming in at one time or leaving all at once. So just some things to think about. We know there are lots of things to think about, but these are really the recommendations for industry. Transportation, if you're headed out to fields or headed to market or a delivery of some kind, this may be the time when you have workers in every other seat, and they wear face coverings, cloth face coverings, just to, cause that or create that added protection, because you can't keep people 6 feet apart in a vehicle. Again, you're going to go through and clean and sanitize surfaces in that vehicle. And then, for field operations, there are lots of times when people are really close to each other, transplanting, weeding, harvesting, but figuring out, how you can position employees, maybe with, a bin or a row or so between them, or other equipment, so that you can maintain that physical distance. Granted, being outside is definitely better than being in a contained space, but we still want to be vigilant of the fact that, people can cough and respire, whether they're inside or outside. So we just want to maintain those precautions. And packing houses, particularly critical, again, because it's a contained space, but looking at what those handling lines look like and figuring out how you can move employees around so that they're not crossing paths so close to each other. And this is another good place where face coverings can help to supplement that physical distancing, which could be really challenging. And then lastly, employee meetings. Some meetings may need to be in person, but maybe, training can be done via cell phone or can be done remote. You can do things via phone calls or text, that kind of, communication, whiteboard, big print posters, just lots of ways to look at communicating, where if you can't physically get people apart, maybe you can use smaller groups of people, and you can keep them spread out a little bit more. Visitors, of course, we always talk about visitors. Right now, this is really important because you don't know, as you never do, the physical status of folks who might be coming to your farm. So, and think really broadly. Are they customers? Are they people who are coming to deliver something? Are they coming to pick up product? You just don't know what their health status is. And so you need to have a policy in place that lets them know what happens when they arrive on your property. Do they come into the office, wash their hands, and then come meet you? What do you expect from them? And clearly communicating that with signs, having equipment, if it's a hand washing station or hand sanitizer available, so they know what they need to do and where they can and can't go. So CDC has some good fact sheets on messaging. And on the next slide, we'll show you, this is the Washington's Department of Health. The state of Washington has a good template that you can use. And we also have a couple of posters that you can put up for messaging for visitors and customers, just reminding them of what your expectations are, because you're protecting both your workforce as well as the people who are coming to your farm for various purposes. Having guidelines. So now particularly critical to know what constitutes, when an employee needs to stay home and when an employee can come to work. And so, just quickly, things to think about are, does the employee have symptoms of COVID-19 or another communicable illness? Do they have allergies? This is one thing that's been talked about a lot. Should people with allergies still come to work? Well, if they always have seasonal allergies and all the symptoms look like allergies, then they're fine to come to work as long as they're practicing proper hygiene. But if all of a sudden they've never had allergies and they have them, maybe they have another illness that they should stay home. So other things are illness in that one person, one of your workers, or if they've been around someone who's been tested or diagnosed with COVID-19 and they've been exposed to someone. Lots of people are caretakers in their homes or in the community. So having a policy in place so your employees know what to expect. Are they going to be paid? I mean, you want them to be forthright. You want them to be able to tell you if they have symptoms, if they've tested positive, and just letting them know what your policies are going to be. You can consider doing wellness checks, and that could be just how are you doing today? How do you feel? Looking for people who, look like they're not in great condition. Some people are doing non-contact temperature screening. All of those are valid ways to check to see what the kind of general health of your employees is, but you really want them to be able to communicate with you or to a supervisor if they're not feeling well. And then I think one of the hardest things is planning for the fact that some of your workforce, whether they're volunteers, interns, paid employees, some folks are going to be sick or are going to have to maybe self-isolate because they've been exposed or they're not sure if they've been exposed. And so just making sure you have some contingency plans for that situation, which might include having some cross training. So you have people who can do multiple things. They're good at harvesting and packing. And so, just kind of thinking ahead to some contingency plans. Some tools for communicating. We have lots of these on the website. There are a couple series of checklists. Those are in English and in Spanish for farm managers to be able to, kind of go down and think, have I really dotted all my I's and crossed my T's in terms of communication? So there are some resources for you. And Christy, if you want to take it from here.
Thanks, Martha. So I'm just going to preface this with, we've done our best to gather information about how to handle employees with symptoms and sick employees based on what we can find right now. But please remember that a lot of this information is changing quickly. So these will be good things to keep in mind, but be prepared to contact your local health department as well. So that's going to be my caveat to these next several slides. So if someone comes to work with symptoms, you're definitely going to want to send them employees home. So that would be if they have a fever or a cough or shortness of breath. Those COVID-19 symptoms, send them home immediately. Then you'll want to think about anybody else who's been in contact with them in the last 48 hours. They would be considered exposed. And so just have an idea who those people were. And then again, just contact your local health department and see what they say. CDC does give some recommendations that exposed employees who do not have symptoms can continue to work, but that they need to monitor their body temperature for fever, wear a face covering, and continue to practice physical distancing. And then if they should become ill or start feeling ill, they should immediately go home or stay home. And so the guidance from CDC is available there at that link. Again, this is just basic guidance. Definitely focus on contacting your health department and getting their advice. And then the final thing, as an added precaution, you want to determine what surfaces that person might have come in contact with, and then do a thorough cleaning and sanitizing, or cleaning and disinfecting of those surfaces that they might have become in contact with. Next slide. So again, you'd want to contact your local health department if you have someone from your farm who tests positive for COVID-19. We have a link there. If you're not sure how to find your local health department, you can use that link there. But basically, what you want to think about is determining again what and who those people might have contacted. So in that previous 48 hours. So any surfaces that they might have come in contact with, just be sure that you clean and disinfect those. Some things to remember and that you should definitely keep in mind as you go through this is do not reveal the name of whoever the person is who's sick. That violates HIPAA laws, so you definitely don't want to do that. If your health department asks, that's one thing to share that with them, but just don't make it something that everybody knows. And then one common question we get is about recalling produce or food products when you have a sick employee. And so CDC, FDA, and USDA have all explained that the virus is not being transmitted by food or food packaging, so there's no need to do a recall. You also don't need to close your farm or your facility just because you have an employee that tests positive. Again, just working with your local health department is going to be your best bet in this situation. And then FDA does have a lot more information about food safety on their website under their frequently asked questions. And so if you go to the website that's there on that slide, that'll give you a lot more information about food safety and COVID-19. Next slide, please. So then you also want to think about setting up guidelines for returning to work. And so you have to decide how you want to manage those risks and what you want to include in your policy or what you're thinking around this. So, things to think about are, the potential of your other employees getting sick, you getting sick, your children maybe getting sick if they're in contact with your employees. So you're going to be in contact with your local health department because you will have had somebody who was sick at your facility. So follow their instructions, but just some things to think about. The CDC has provided some guidelines, so you have some idea of what one of the options might be for returning to work. And so we have the link listed there, but I summarized them. So there's two strategies for returning to work. One involves testing and one doesn't. And so it's important to remember that test results can take anywhere from days to weeks to get back. So it's good to have these multiple options available. So the non-test-based strategy is that you're not going to have a test to return to work. So you're going to monitor, the employee would monitor themselves and make sure they haven't had a fever for 3 days and that they're not using any kind of fever reducing medication like Tylenol or aspirin. You want to make sure that they aren't exhibiting any of those respiratory signs, so cough or shortness of breath, and that 7 days have passed since the appearance of symptoms. Or the other option is using testing. So again, not having that fever without the use of those fever reducing medications, improvement of the respiratory symptoms, so the cough and shortness of breath have gone away, and then that they have 2 consecutive negative tests that have been 24 hours apart. So those are the guidelines that CDC has put together right now as far as returning to work after somebody has been diagnosed with COVID-19. And again, talk to your local health department. They're going to be your best bet for identifying this. We just wanted to provide you some of the basic information that's out there right now from CDC. Next slide, please. So now we're going to shift gears a little bit and we're going to talk about what you can do. So this is kind of just a high level summary of what we've already talked about, but hand washing is critical. It's even more important now. So provide those extra hand washing stations and ensure they're well stocked. Keep an inventory of your supplies and order enough supplies to keep you stocked without running out, but without overdoing it. Certainly don't need to clean out the grocery store or anything, but just making sure that you have enough to be prepared. Since it's difficult to find hand sanitizer right now, you can make your own, and the World Health Organization has put together a guide on how to safely produce an effective product. So you can visit that site, and it'll give you some information on making your own. We didn't talk a lot about employee housing, but if you do provide employee housing, ensure you have plenty of supplies for them. Make sure you have a working hand washing machine so they can, and a dryer so they can keep their clothing clean, fresh drinking water, frequent trash removal, those type of things that you would normally do, just highlighting those. Designate one employee to oversee all of your hygiene activities, and then empower them to make decisions and policies to keep everyone healthy. So it's really important to have that person have one person overseeing those activities. And then finally, having written policies is also an important practice for communicating your processes and policies to your employees. It provides them something they can refer back to, and also helps you with training new employees, and it ensures that everyone's following the same process. So you should create written policies for hand washing, glove and mask use, physical distancing, sick leave, return to work, and visitors, and probably some other things, but those are kind of the high level ones. Next slide, please. So some other things you can do are, order or print signage, either what we've provided to you or something you find somewhere else that indicates, policies and procedures that you want your employees and visitors to sign. Post those things in areas where it can be viewed frequently. So you want to include information about the symptoms of COVID, your come to work and sick leave policies, your hygiene requirements, anything that you want to keep front and foremost in your employees' minds. And then also thinking about visitors. So, letting them know, what your expectations are of their hygiene, and also, the designated areas you have determined that they can visit on your farm. It's important to show your commitment to your employees about keeping them safe and keeping them working. So to be sure that everyone understands your processes, you should make sure that you provide the time for training, and be sure to communicate frequently with your employees, either with reminders or about new changes to existing processes. As we mentioned, much of this information is changing rapidly, so it's important to remember to communicate all this stuff with your staff as it changes or as you change your processes. And then we really want to emphasize that there's not a lot of new information about health and hygiene or cleaning and sanitizing practices during this time. You should just continue all of the good food safety practices you already have in place in your farm, and maybe just think about ramping them up or doing things a little more frequently. And then also remember, there's not any new regulations for COVID-19. What we discussed today are best practices and recommendations to help prevent the transmission of COVID-19 and hopefully keep you and your staff healthy. We just want to let you guys know that, there isn't anything new as far as regulations. You're not going to be inspected for something related to COVID-19. It's just going to be the other regulations or other practices that you've done previously. Next slide, please. So here's where we tell you guys where the resources are. So many of you have hopefully been to our website. So it's www.coproducesafety.org. And for those of you that haven't been there, recently we created a whole new page for COVID-19. So I have it highlighted there with the red box, and then the arrow shows what that page looks like when you open it up. There's a lot of information out there, and as Martha mentioned in the beginning, we're with this presentation we're trying to sift through it, but then also with our website we're trying to provide a concise list of resources that will help you guys understand the stuff, and also provide additional training and resources for your employees and your processes. So when you click on that COVID-19, you can see that opens up several information. I want to direct you, since we're talking about worker health and hygiene, if you scroll down the page a little bit, there's a box that says worker health and hygiene training. When you open that up, it gives you another page with more resources. We still have all of our normal worker health and hygiene resources available on our website, so you can find those as well. These are just specific to COVID. Next slide. So AgSafe has put together some good videos. They're short videos that you can watch with your employees in both English and Spanish. And so those can be, again, just more good resources. And those are on that page that we showed you a minute ago, but those links are there as well. I really want to encourage everybody to visit our website. Many times farmers indicate they need resources, and we already have what they're looking for. They just have to go to our website, or you can reach out to us, and we're more than willing to help you find what you need. And then finally, these are just some more links for information from all the high-level agencies, CDC, FDA, Western Growers, USDA, CDPHE. There's just a lot of information out there. So if you can't find something you're looking for, reach out to myself or Martha, and we'll help you. We're always here to support you, but know we're available for you, especially during this uncertain time. So please don't hesitate to contact us. And here's our contact information once again. Back to you, Martha.
Great. And Adrian, I believe you're going to take it over here.
You betcha. Get the screen shared. You guys did such an excellent job. It's a lot of information you distilled into that. And I'm really pleased we're going to have a PDF of this because folks were asking over and over about being able to click those links. Let's determine educational outcomes before we conclude here. You'll see on your screen, folks, 2 questions. Did you learn something new today? And will you use the information that you learned today?
And Adrian, could I just add, while people are answering, we since we shared those screenshots of our website, we added even more resources. So we're going to be trying to, get as many resources as possible that are just there for people to access as they need them.
That's great. Thank you, Martha. And in addition to that excellent coproducesafety.org website, this is CFVGA's website that has many similar resources on it and a couple of additional ones. But certainly Martha and Christy have drilled in deep and have a great curated list of resources and resources that they've produced for you. So I'm going to end the polling there. And hey, everybody, most everybody learned something new today and is going to put it to work. So thank you both so much for putting together such a great webinar. We will send the PDF out to all of our registrants. And Martha, anything else you can think of before we close? Okay.
No, I'm sorry, I had to unmute. No, I think that's great. We really appreciate you keep sending on your questions. You can email us afterward, and please join us next week. We're going to take a really deep dive into cleaning and sanitizing and disinfecting. We felt like we needed to have the full webinar time to do that. So we hope you will join us next week as well. Thank you, Adrian, so much.
Thank you. You're welcome. Great work, Christy and Martha. We'll see you all next week. Thank you.